Behind the scenes, behind the lines, inside the stories others won't tell. The Morning Insiders.
Insulin's got a bad rap for breaking the bank, and a new Illinois law was supposed to cap the price at $100 per month.
So why are some still being charged 8 times that amount? Morning Insider Tim McNicholas looks into the law's shortcomings as well as another state that's found a potential solution.
So you just score out the dosage.
For George Levin, this box holds a lifeline, but it comes at a cost.
I don't know what other options are at this point.
You see, Levin can't work right now because of a recent surgery. His partner, Jeffrey Giles, was laid off in early 2020.
It's been impossible to find a job.
This whole year has been a little bit of hell.
So they're paying $1,400 a month for a private insurance plan, a plan that still leaves them paying hundreds per month for insulin.
And all my other drugs are affordable.
Then they heard about a solution from Springfield, a new law that caps insulin prices at $100 per month starting in 2021.
Thrilled.
But when the couple tried to get the insulin from CVS this month, they were charged more than $400 for a 2-week supply. When they brought up the new law,
They were clueless. They didn't even know what we were talking about.
they called their insurance provider, U.S. Health, who explained that the law does not apply to their policy, apparently because it's not a state-regulated plan. One of the bill's sponsors, Representative Will Guzzardi, told me in a phone call he's heard other stories about what he calls miscommunication around the question of what it means to be state-regulated and where they got their plans from.
I think it would really help if the state put some kind of information out there, maybe public service announcements, a hotline people could call just to get a handle on getting questions answered.
We've learned other states that pass cost caps have run into similar problems, with residents disappointed to learn the law only applies to state-regulated plans. That's one reason Utah recently followed up with another law that gives residents a rebate up front for insulin regardless of your insurance. The sponsor says it mainly helps people with high insurance deductibles or no insurance at all.
I mean, it's not the lowest possible price that anyone could get, but it's a whole lot better than paying full retail. So we're talking about discounts of well over 60%.
We sent that law to Representative Guzzardi, and he said he's looking into it, as well as a model in Minnesota that creates an emergency insulin supply for people in need. Levin and Giles say what really would help is a bill that caps the cost at $100 regardless of your plan.
And that's what we assumed it was based on what I read in that bill.
For now, all they could do is hope their 2021 is better than 2020. Tim McNicholas, CBS 2 News.
After we reached out to CVS, they called that couple back and offered them a cheaper option for insulin, but the couple says they'll still have to pay about $500 per month. As for their insurance provider, U.S. Health, we have not yet heard anything from them. For more stories like this, download our CBS Chicago app and look for the section called Morning Insiders.